Welcome back, and thank you so much for staying with Monday Special. After the program tonight, Monday Football will be coming to you live from Mombasa County. The team is there, and they're also going to be speaking to Governor Hassan Joho on location in Mombasa. So Monday Football on location in Mombasa should be really exciting. Please stay tuned for that after Monday Special. And on Monday Special tonight, we talk about breast cancer. I'll introduce you to my panelists before we listen in on a video testimonial of a survivor. First, we have Dr. Sidna Mwanzi. She is an oncologist at the Aga Khan University Hospital. And then we have Lola Wanjiru, who is a breast cancer survivor as well as a nurse. So we'll be listening to the two of them in just a few moments. Remember to use the hashtag MondaySpecialKE to send in any questions, queries, your views as well, or text us on 22422. Here's the first testimonial that we'll run for you on Monday Special. Take a look.
I was diagnosed with cancer, that is a year ago, in the month of September. They operated me, and by the grace of God, after 5 hours, I came out. Unfortunately, I couldn't start my chemo immediately because it was found that I was pregnant. And taking chemo with the baby, with the pregnancy, could have harmed my baby and even my health. So after consultation with my oncologist, Dr. Vijay, it was like, for the sake of my health and for the sake of my life, we had to terminate the baby. The pregnancy was terminated, and after 1 week, I was able to start my chemotherapies. After chemos, I was supposed now to do radios, so I did 30 sessions, finished them in the month of May 23rd, and here I am. I bless God, for I am strong, and God has seen me through. My word to you, the moment a patient comes to you and you realize it's cancer, please be human enough. Take them through counseling, create some hope in them. Okay, public, there's this stigmatization of a cancer patient. When you're told you have cancer, it's the end of you. No, it's not the end of you. Please, when you're told you have cancers, just take it like homa. I remember when I went to Dr. Vijay, he was like, this one, we treat it here like homa. So just take it like you have a flu, you're going to see a doctor. When you have a flu, I think the doctor will always prescribe for you a certain medication, of which after you take it for like a week, you'll be okay, the flu will have gone.
The first testimonial there, and that survivor, of course, was brought to us by Eda's Hope Cancer Foundation, who do a lot of work on the ground regarding cancer treatment. So, Doctor, let me start with you. Where are we regarding trends when it comes to breast cancer in Kenya? Like we say, this is a discussion that's been had time and time again. We know cancer is now a huge killer across the board. Yeah. When we look at breast cancer, what are the statistics like? How many women are affected each year, and what are the trends?
Okay. So in Kenya so far we have about 40,000 cancer cases diagnosed.
Every year?
Every year.
Okay.
And of those, 20 to 25% will be breast cancer patients in the women population. Yeah. So it is the most common cancer in women. Yeah. So I think we are seeing an increasing trend of people coming and getting diagnosed because we have better equipment. People are more aware and they're coming when they have symptoms, and many people are coming for screening. So I think that is contributing a lot to the increasing number of patients that we are seeing. Yeah.
How much is lifestyle playing a role in this?
I think it's a multiplicity of factors. It's not just one thing that will lead to cancer. There are multiple factors, and when you have them, they all play a role. So lifestyle factors that are important in breast cancer are physical inactivity, obesity, alcohol, and a diet that is not rich in fruits and vegetables.
Okay. Yeah. And this seems to be, again, I stand to be corrected, we're seeing a lot of people's lives being taken by cancer, different cancer, whether it's gallbladder, breast. Would you peg this on, again, lifestyle? Because it seems like we're seeing more cases now than we've ever seen in Kenya before.
I think it's like I said, it's not one thing. Yes. But it does definitely contribute. We have many more people that are smoking. We have, in fact, Kenya has a huge problem with alcohol intake. We've changed our diet. We're using more of a Western diet that is not rich in fruits and vegetables. So that has contributed a bit to it. Yeah.
Research says that Kenya has about 30 cancer specialists. Is this accurate?
I'd say if you combine both the clinical oncologists that do radiotherapy and the medical oncologists and the pediatricians and the surgeons, we're about 25 to 30. So over a population of 40 plus million people, that's a very small number. And to say that majority of those specialists are based in Nairobi.
So that's a huge problem.
Yes, that's a huge problem.
Regionally, where do we see most of the cases being diagnosed? I know you said that maybe in Nairobi we see the statistics come out more because more of you are here.
Right.
But regionally, which place is most affected by these cases?
I think currently it's difficult to tell because we do not have a population registry. So we have a Nairobi-based registry that looks at Nairobi and its environs, and then we have an Eldoret-based registry that looks at that area. So it's kind of difficult to tell, but definitely the urban areas are overrepresented, and that could be because of access to care.
Before we move to Lola, again, we've seen 30 specialists, a population of about 40,000 that are diagnosed. Cancer doesn't seem to be given the seriousness that it should. People's lives, people are losing their lives each and every day. Where do you think the gap is? Because I think as a country we should be advanced enough. We should be moving forward. Where do you think the gap really is?
I think we struggled a lot with the HIV pandemic, so we put a lot of resources in that, and now we have to shift gears to non-communicable diseases, so it's taking a bit of time. But what's good about that is that we're using the models that we used for HIV to bring care for non-communicable diseases. The government has shown a lot of initiative in the recent past in terms of increasing access and even NHI funding. So I think there is a gap, but we're sort of moving in the right direction.
All right. I know we mentioned lifestyle. A little later on, you'll tell us more about some of the other symptoms and causes and screening especially. Lola, let's move to you. You're a 26-year-old cancer survivor. So first of all, thank you so much for being on Monday's special. Could you tell us a little bit about your story? When were you first diagnosed?
2013 October. After I went for a camp, I was participating in a camp. I was a student nurse then. And after that, I was sent for an FNAC, which turned to be benign at first. Then I was advised to go for a biopsy because the lump was highly vascularized. Didn't look good, so I went for a biopsy. And the biopsy came back positive. But I was in denial for quite some time, for like a month or so. So I was advised to see a specialist. But there were no specialists where I was studying, so I had to go to Aga Khan University in Nairobi. I met Professor Wasike, and I started treatment from there on. And the encouragement I got from the oncologist and the surgeon is what kept me going, because when they say you'll be fine, that's the only thing you want to hear. That's the only thing you understand at that particular age, because I had already planned my life. You know, the way you pray and you just tell God, at this age I want to be here, I'm finishing school in 1 year's time. So all that was setting me like free, because I had planned my life, and the oncologist has said I'll be fine after chemo and
so it gave you a lot of hope.
A lot of hope and courage. And I also met mentors, people who had survived 4 years, and I was thinking like 4 years I'll be where now. I was counting. So I was grateful.
Well, how aware were you about breast cancer before you were diagnosed? Were you the kind of person who used to do breast self-examination, or is it now that you've learned so much because you're a survivor?
Okay, I used to do them because we were taught in class. We had an introduction on breast pathologies and stuff. So I used to perform a self-breast exam. I used to feel the lump, but then I was so young to think of cancer. I thought it was hormonal. So I felt it the first month, June, the second month on July, August, and after 4 months, I was told to go for an FNA because it was growing. And after that, when I went for the FNA, I just thought that this pathologist cannot be right. Maybe they had confused something. So I had to do another one to confirm, and I did another biopsy to even confirm. So by the time I was starting treatment, I was thinking to myself, like, this lump could have been maybe lifestyle, because I was from the rural, now I'm urban, so that changed. So I had so many factors to consider, but
you never thought cancer was one of them.
I never thought cancer was
Let me step in and ask Dr. Mwanzi something. I think Lola could be saying what a lot of women are thinking or feeling, especially young women, when you do the breast self-examination. How do you know that it's a lump, a cancerous lump, as opposed to what she was saying, I just, you know, you could think it's anything else. How can you tell?
So I think the only definitive way of saying that the lump is cancerous is having a biopsy like Lola had.
Okay.
But there's some things that will stand out. For example, the lump that is growing in size, and then a lump that is fixed to the chest wall, or a lump that is causing changes in the skin, or if you have the nipple going inwards, or there's a nipple discharge, or if you have even swelling in the armpit, that kind of tells you that this is not a good lump to have. Having said that, a large majority of lumps, especially in younger women, will be non-cancerous, but all of them need to be evaluated because, as you've seen in Lola's case, it turned out to be cancer. Yet she, as she said, it wasn't something that was on her radar.
Yeah, and also painless, right?
Yes, majority of them are painless.
Okay. So then that was 2013, you said?
Yeah, 2013.
And what's your journey been like over the last three years or so?
Okay, by the time I was getting treated, it was already 2014. From October. So, like when I met Professor Wasike, I met him in Feb after my birthday, and we discussed. So I met him on a Thursday, and on a Friday I had to go to theater because my breast tissue are a little bit smaller. So he said, I don't want this to be to grow very fast, so we have to go to theater.
Okay.
He did a breast conservative therapy surgery and axillary lymph node dissection.
Okay.
Took them to the lab, tested them, and I had to go for chemo.
Okay.
They suggested I had to go for chemo and radiotherapy.
All right.
The most maybe difficult part was the chemotherapy.
What was so difficult about it?
Because I had asked if my hair, I lose my hair, because I knew the effects of chemo.
Yeah.
So when I thought I'd lose my hair maybe after the third chemo, so I had set myself in a salon to do my best. I remember I called my mom then, and I told her, now I want to do my best hairstyle. Send me cash. She sent me the cash. When I went to the salon, and the first blow dry, the second, and my hair, even the salonist thought she's making a mistake. Oh, because
so
it
already
started dropping.
Yeah.
And no, I think that was the hardest part.
Yeah.
Okay. The dropping of the hair, and also after the fourth chemo, I had some really bad effects. Okay. Because I had to be hospitalized, dehydration and stuff, and it was not so good. Okay. But with time, I grew fond of the people around me. The support system, they were very encouraging because I was still in school and didn't defer. And during radiotherapy, it was not so bad. Okay. Yeah.
But it sounds like you have a support system, which is amazing. And and that's, I think, what you'd want to say for survivors. That's what keeps you going. Is a support system. How are you now?
At the moment. The support system is not always like 100% what you expect it to be, but maybe the 80% that remains is very encouraging and very important, because it made me realize that you don't need like everybody, and you don't need people who are sentimental.
You just need people who will be there for you, keep you and strong. Sorry, I know we don't have a lot of time. You're expectant now. Congratulations.
20 weeks.
20 weeks. So, I mean, you sound very courageous, and you just sound like you're all about embracing the life you have. What would you want to say? For instance, I have a lady here, Wambu, who says, I'm a survivor, but I feel lost. I've lost my breasts, my hair. Yes, I'm in remission, but I don't feel like a woman anymore. How can I feel better about myself? What would you say to someone like Wambu and the many other women out there?
Number one, after diagnosis, what I told myself is that I won't stop planning my life just because I've been diagnosed. I'll keep on planning for it. If I was planning to do some business, I still do it. If I'm planning to farm, I'll still do that. If I'm planning to graduate and look for a job, I'll still do that. Like, I take the course where God wants me to go, and at the same time accept myself and be strong for myself than anybody else can be strong for me. Because at that particular moment, after diagnosis is one of the most hardest part, but at the same time, it's not as hard as you demoralizing yourself. Just take it easy, and one step at a time.
One step at a time. Yeah. Before we wind up and hear from Dr. Mwangi, especially about early detection, this is the second testimonial that we have. Let's run it.
I had a small lump in my left breast, so it was very small, and I didn't take anything seriously. So what made me to go to the hospital is that I noticed the lump growing, so I went to the hospital where I was removed some samples, and it was cancer stage 2. It was really hard. It was tough. I can remember that day when I was diagnosed, I lost my phone because I was confused. I didn't know what to do. I didn't know where to go. So I did my operation at Coptic, and then after operation, I started my radio, my chemo, which were 6 sessions. I went through 6 sessions. After chemo, I went my radio for 25 days. People take it differently. Yeah, there are some who think that cancer kills, it is the end of you. But cancer, I can say, it's not the end of you. It doesn't kill, because there are many things that kill. Water can kill, fire can kill, accidents can kill. There are many things that kill. It's not the end of it. If you have cancer, you can still make it as long as you have faith in God. You embrace it, you accept it, because if you accept it, you'll be able to heal faster.
Right, we're celebrating survivors like Gladys and yourself, and I think she's echoed a lot of what you said, so thank you so much. Doctor, as we wind up, 2 things. First of all, recommendations for breast cancer screening, very briefly. Women aged 40 and older.
Right.
What would the recommendation be for that?
So women aged 40 and over is a mammogram.
Okay.
But anyone, and that's for screening, but if you have a lump, then it has to be tested.
All right. Women in their 20s and 30s?
So we are currently using American and European guidelines, and they don't recommend screening at that age. And that's because the risk is lower, and the risks for doing the mammogram itself.
And finally, breast self-examination.
Right.
How can someone check? That's another question that we got asked.
So I think the reason to do the breast self-exam is to know how your breasts are, and the best time is to do it after the period, because during the period and just before that, the breasts become very lumpy and swollen, and so you let that period end, and for people who are postmenopausal, they choose 1 day of the month and just do the exam.
Breast cancer in men. Tell us a little bit about that.
So if you're looking at 100 patients with breast cancer, only 1 of them will be men. Having said that, it's still something that we see. This year, I think we've taken care of about 4 male patients with breast cancer. So it does happen.
And the same symptoms, the same, how do they examine?
So I mean, I think for men it's much easier because they don't have as much breast tissue as women. So the lumps tend to be picked much earlier. There are no clear screening guidelines for men. But they tend to be picked up much earlier because they have very small breast tissue.
Okay.
Right.
Your parting shot, because I know we could talk a little bit about the risk factors, etc. What would you want to tell people about awareness around breast cancer? I know we'll also be having a lot of screenings probably this month, but what else would you want to say to them?
So I would tell women to examine their breast every month, because at least it lets you know how your breasts feel, and if there's something abnormal, you'll find it. And then get a clinician to examine your breast at least once a year, and if you're within the screening group, go for your screening. And then if you're found to be with a lump, get it investigated so that you can have early treatment.
Okay, and don't just wait till October. I think a lot of people tend to do that. I think there's even a campaign saying not just October, something along those lines. That's your campaign. I think that's something people need to keep in mind. But thank you both so much. Once again, Lola, we applaud your courage and wish you all the very best.
Thank you.
Even in your journey towards motherhood. It's very fulfilling, by the way. And thank you so much, Doctor, for coming and shedding light.
Thank you for having us.
All right, we'll take a short break and be back with some of your feedback on Monday Special.